Hi, welcome back, and today we have a very special guest, Dr. Gewertz. And first, just introduce yourself a little bit.
I'm Bruce Gewertz. I was in the Jefferson Penn State expedited pre-med program, and it's a great pleasure to come back to Penn State. I'm currently the Chief of Surgery and Vice Dean for Academic Affairs and Vice President at Cedars-Sinai, which is the biggest hospital on the West Coast.
And could you give us a little bit of background, like where you grew up and a little bit about what inspired you to become a doctor?
Yeah, I grew up in Havertown outside of Philadelphia, and I was actually inspired to be a doctor as much as anything by a couple of experiences I had when I was in high school. I had a very motivated chemistry teacher who hooked me up with the National Science Foundation program, first at Hahnemann Hospital between my sophomore and junior year of high school, and then at Roswell Park Cancer Hospital in Buffalo, New York. So I got to operate and do research, and after that I knew what I wanted to do.
And what led you to apply to the Penn State program?
Well, I found that my folks didn't have a lot of money. I knew I wanted to be a doctor, and one of my friends in high school, the year ahead of me, who I admired very much, had gone to the Penn State expedited program, and it seemed like a great opportunity.
Now, back in the days, you said it was a 5-year program?
Yes, it was 1 year at Penn State, which was 5 consecutive trimesters,
Okay.
and then off to medical school.
And so, what do you think were some advantages and some disadvantages of being in an accelerated program compared to just going the traditional route?
Well, the obvious advantage was I got to do my life's work sooner. So when I finished medical school, I was only 22. I had a tremendous amount of energy, and the difficulty of doing a surgical residency at that time, which was quite considerable, was lessened by me being so young and vigorous. But the downside was that once I got to Jefferson at age 18, I was way less mature than many of the other students. They had wives or husbands and children, and I was barely out of high school. So things that wouldn't upset me so much 4 or 5 years later were harder for me to deal with. So I think it made it a little bit more of an emotional roller coaster.
Okay.
As well, my studying habits were not so great, and it took me a while to get into the groove of what a graduate school was like.
So now, can you walk us through some of the highlights of your career that have brought you to where you think you are today?
Well, after I finished at Jefferson, which was a great clinical experience, I was fortunate enough to go to do my general surgery residency at the University of Michigan, which was really a terrific experience. And I had great colleagues who were residents with me, who've gone on to be leaders in American surgery. And I was trained in an extremely positive and busy environment where I was really mentored into being a surgeon. I then spent 4 years at Southwestern in Dallas, where there was just a tremendous amount of operating for me to do as a young physician. And then had the great good fortune to be recruited to the University of Chicago, where I practiced vascular surgery and eventually became chairman of the department there. And then for the last 13 years, I've been fortunate enough to be chief of surgery at one of the biggest and best hospitals in the country at Cedars-Sinai in Los Angeles, and have had an opportunity through happenstance and desire to learn a lot about very different elements of medicine and life and commerce.
Okay, so now a lot of the people who are going to be watching this video are probably either in accelerated programs right now or thinking of applying to accelerated programs. Do you have anything that you think is critical for them to take advantage of while they're still in college?
Well, I think that you really do need to be sure that you get the college experience. And even though mine was very abbreviated, I feel like I did get a very good opportunity here. And then, of course, I went to the University of Michigan for my residency, so I was effectively back in college. But I think that it's very difficult when you're young and in an intense learning environment to get some perspective. I I think the good thing about accelerated programs are that if you put one foot in front of the other and you study hard and you get decent grades, that you have a high likelihood of following through and getting into medical school. So it does remove a lot of the anxiety about medical school admission.
Now, a lot of people in combating physician burnout cite that they have hobbies that they enjoy. Do you personally have any hobbies that help you with preventing physician burnout?
Well, I do. I love athletics. I work out virtually every day. I love golf. And most importantly, I have a great and supportive wife who keeps me grounded and who's been just an incredible help for me when things have gotten difficult.
Okay, so one or two more questions before we close this out. So accelerated programs are known for helping to foster, especially the Penn State Jefferson one that we're a part of. They're known for fostering close relationships between students because they're together for, in your case, 5 and nowadays 7 years. So do you and your peers from back in the day still stay in contact, and do you have any interesting stories about that?
Well, we do, and ironically, last night I went out to dinner with one of them from, who was my roommate here in the freshman year. I do think that we shared a common experience, and we all felt like we needed to stick together. And then when we got to Jefferson, because unlike you, we were really out of phase age-wise, it was very helpful to have the opportunity to talk things over with people who are truly my own age, rather than just my educational level. So a number of those colleagues of mine have become leaders in American medicine. I see them at meetings. We have a bond. Most recently, I had the chance to be a visiting professor at the University Hospitals of Cleveland. I was invited by the head of vascular surgery, and he had gone to the accelerated program when it was a 6-year program. And we talked about Penn State, and it was very unifying.
So now the last question is going to be more of a fun one. So on October 18th, Penn State, we're going to be playing Michigan, as you know, and since you did residency at Michigan, but also went to college at Penn State, so who do you think is going to win that game?
Well, there's no question that Penn State's going to win the game, and I can tell you that my general tendency over the last 40 years has been to root for the team that had the best chance to win the national championship. And this year, it's unequivocal that the Nittany Lions have a far better chance than the Wolverines. So you can count me on the Nittany Lions side, and I anticipate a big victory.
Thank you. Thank you so much for agreeing to this interview, and that's it, I guess.
My pleasure. I wish you guys the best.
No problem. Thank you.
Thank you.